So ASCO 2020, from a renal cell carcinoma perspective, is interesting in a number of different fronts. There's a very exciting study that's being presented on the combination of erlotinib plus bevacizumab in individuals with papillary renal cell carcinoma. In particular, individuals who have another hereditary disorder called HLRCC, or hereditary leiomyomatosis renal cell carcinoma syndrome. These individuals are at increased risk of developing these very rapidly growing, aggressive type 2 papillary renal cell carcinomas, which will metastasize and cause death in these individuals at a very high rate. When they do develop metastatic disease, it's been very hard to treat. But this study demonstrates, and it's a follow-on of an abstract that was presented a number of years ago, that the combination of erlotinib and bevacizumab has resulted in an objective response rate of 64% in the HLRCC cohort in this study, which is really quite unprecedented and really is a groundbreaking piece of data for patients with advanced HLRCC-related renal cell carcinoma. There are a couple of other studies looking at when and how to give the combination of ipilimumab and nivolumab. We know now with the Checkmate 214 study that there's been great response rates, complete response rates, durability of response in individuals who've been previously untreated with metastatic clear cell renal cell carcinoma who then receive ipilimumab and nivolumab. These studies, including the Omnivore study and a couple of other studies, Fraction RCC, their goal really was to ask the question of whether you could actually spare individuals some of the toxicity of upfront combination by starting with nivolumab and then adding in ipilimumab to the individuals who were non-responders. And what happens there, and it's fairly consistent across all of these studies, is that it looks like you start losing some of the magic. The objective response rates are relatively low with nivolumab monotherapy in the teens or so. And then when you try to rescue with adding in ipilimumab to either the patients with progressive disease or stable disease, you're not seeing the bump in objective response rate, and you're not seeing the complete response rate that you saw with these other with the upfront combination. So this really, I think, tells us that we need to, although it does result in additional toxicity, give that combination of drugs upfront together.